When I found out I was pregnant for the first time, we were very excited. I went and woke my husband up. We were nervous, but we were ready to embark on this journey. When I was thinking about how this baby's gonna come into this world, I remember thinking to myself, I really do want to have a vaginal birth. Like, I want to, push for this. No pun intended. If I can avoid a surgery, I'm going to.
Several benefits to vaginal delivery. The first being a much shorter recovery, especially a mom who's had, who has additional kids at home. Getting back to her normal level of functioning at a quicker fashion is definitely ideal for the entire family. Secondly, with any type of delivery, there is a certain degree of blood loss. With the vaginal delivery, it's much more decreased than it is compared to potentially a cesarean delivery.
There are many benefits to a vaginal delivery. For moms, recovery time is often shorter and easier. And for babies, traveling through the birth canal can help decrease the fluid in the lungs and increase exposure to healthy bacteria.
There are several times where a C-section is absolutely indicated if the baby is breech. What that means is if the baby is coming down feet first or bottom first, either of those is an absolute need for a C-section.
There are many things women can do during their pregnancy to give them the best chance of having a vaginal delivery. I think two of the most important things are diet and exercise. We know that women who gain the recommended amount of weight in pregnancy and don't gain too little or too much have a greater chance of having a vaginal delivery. Excessive weight gain has been linked to an increased incidence of cesarean section. If your labor starts naturally, which we always hope it does, it can be hard to know when to come to the hospital or the birthing center. And it somewhat depends on if it's your first baby or if it's your second or third or etc. So if it's your first baby, we instruct women to time their contractions when they start and to call us when their contractions are 5 minutes apart or less, lasting a minute long, and really starting to take their breath away, and she has difficulty talking or walking during the contractions.
Some of the tools that are easily available to mom, the exercise or peanut balls that you can get online or at, Bye Bye Baby, for example. Those are some really, really great tools that can really start to help get the process going and get the ball, for lack of a better term, rolling with getting labor going along. The peanut ball is actually something on labor and delivery that we use often because what it does is it helps to widen the pelvis. So the peanut ball, when sideline, actually can be very beneficial to a patient. Another thing that I often tell my patients is good old-fashioned intercourse. A husband's semen contains something called prostaglandins. Prostaglandins are these natural substances that cause the cervix to start to ripen and also can bring on contractions.
Some things that really helped me along, I think it was really important that my doctor looked at me and was like, because there was points where I was like, I can't do this anymore. I cannot push anymore. And she just looked at me and she was like, yes, you can. All you're worried about is getting that baby out safely. You find that inner strength and you push that baby out.